Well, here we are with Dr. Rosemary Mencia, who is our fantastic dentist, and we have so many questions that we want to ask her. We never think of dentists probably answering some silly questions. You go to a dentist, you have some serious problems like root canal or other things, but I have a very, very easy question probably for someone like Dr. Rosemary. I want to know how to brush teeth properly. And Dr. Rosemary, they probably don't ask you, but you probably tell them, I don't think you're brushing your teeth properly.
Yeah, we can see when patients are not brushing their teeth properly. When they come in for their checkups and we see an inordinate amount of plaque accumulation, we can tell that they're not brushing properly. And they tell me, of course, that I'm brushing and I'm flossing. And usually it's because sometimes they're using a manual toothbrush. The toothbrush is not reaching places in the back where, the head may be too big. It's difficult to get. What I recommend to all of my patients is to use an electric toothbrush. The electric toothbrush usually has a much smaller head, and with the oscillations, it really gets every place that it's impossible to get with a manual toothbrush. I do recommend the Sonicare toothbrush because most of the research has been done on the Sonicare, and it's been proven time and time again that it works, 100% better than the other electric toothbrushes out there, and that really it gets your teeth as clean, and with regular professional care, your teeth feel as clean as when you get your teeth cleaned by the dentist.
But what about your gums? Is it massaging your gums too?
Yes. What it does is it's cleaning your gums, the area in between your gums and your teeth. So it's really just massaging everything. So you're getting that cleaning and you don't have to apply force. What you see with a lot of patients is they have recession by their gums. And when you see that, the one question I ask them is, do you brush very hard? And the answer all the time, undoubtedly, is yes. And the reason is because people feel that the harder I scrub, the cleaner my teeth are going to get. And I tell them that's not true. So once these patients switch to an electric toothbrush, then they don't have this problem anymore. We fill the areas where they have the recession. Usually we put some white fillings there to protect their teeth, protect the enamel, and then they switch to electric toothbrushes. Electric toothbrush, you cannot put a lot of force. Once you apply too much force, usually the toothbrush will stop.
Oh, that's great.
So it does all the work for you. You just have to, let the toothbrush do the work. Basically.
And how long do you brush your teeth when you use electric? Is it shut off when it's
a lot of times it will shut off. It'll go, per quadrant. It'll do basically, 2 minutes or whatnot. And a lot of times it'll just beep when you're done and when you're supposed to move on. Especially the better toothbrushes will just beep when you're ready to go to the next area. So they really are quite amazing. It's like a no-brainer. So they really work well, and I have seen patients who've switched to electric toothbrushes significantly improve their gingival health. Significantly.
Okay, so now I'm a flosser. Do I still floss?
Always. Flossing really, the electric toothbrushes do a great job of keeping your gums healthy. But really, flossing, you should never really go without flossing. Like I said, the electric toothbrushes do a great job of keeping your gums clean and everything. And if you skip a day of flossing, you're not gonna die. Nothing's gonna happen to your gums, especially if you're using the electric toothbrush right. But flossing, you really should always be flossing twice a day.
Thank you, Dr. Rosemary. That seems like probably not something you're going to go ask your dentist, but I think it's important. A lot of our listeners are probably flossing. Probably using a plain toothbrush, and maybe that's okay a little bit. But it sounds to me like everybody better go get themselves an electric toothbrush and do it properly. Now what I want to talk about, because it's, we see different, we look at different kinds of people with their teeth, and they could be a wonderful person, but when they open their mouth and you see their teeth, right away you start making decisions about them, which is not right. But people who don't have straight teeth, maybe some people, I've seen some beautiful women who dress impeccably, their face is beautiful, and they open their mouth and they got these crooked teeth, and I wonder why they didn't have that taken care of.
Yeah. It can be a multitude of reasons. Sometimes people get braces when they're young. They don't wear the retainer and their teeth revert back to what they were. Sometimes they couldn't get it for financial reasons. There's different reasons. But Anita, what you said about people making judgments about people because of their teeth is so true. So true. There has been so many reports and so many studies that people that are better looking get jobs. People, how many times do we hear that over and over again? And I've had a lot of patients come to me who have said to me, "Doctor, I'm unemployed and I need to get a job. I'm looking for a job and I need to fix my teeth." Because they know that they're going to be more sellable with a better looking smile. And it's 100% right, 100% right. So really your smile is one of your best assets, is, your teeth. So about the question about straightening your teeth, there's a lot of things we can do to straighten your teeth. No question. Nowadays, the simplest way to do it is obviously people go and they can have braces done. They can
even as they're older?
Yes. They can get, what we do is there's something called Invisalign. Invisalign is basically invisible braces. And you say, what are invisible braces? Invisible braces are, it's like retainers that you wear. They're clear retainers. You wear them 24 hours a day. The only time you take them off is to eat and to brush your teeth. Now, everyone is not a candidate for that with crooked teeth. If you have very advanced orthodontics, meaning you have very bad malocclusion and your teeth are, just really not a candidate for Invisalign. Invisalign is more for straightforward cases. People whose teeth may be crooked, who have some crowding or some spacing or so on and so forth. But if you have very advanced orthodontics, you may need to go get the traditional silver braces. And I have seen adults who want to improve their smile, and they go and they get this done. But Invisalign is a matter of just an appointment where we take impressions, we send it to the Invisalign laboratory, they send us back all these trays. Every 2 weeks you come in and you get a new tray in your mouth. And you wear it all the time. It does not affect your speech. It does not affect your appearance. People can't even tell you're wearing it. And it's a remarkable difference what it will do to you. It'll close spaces. It'll straighten your teeth. And sometimes we don't only straighten teeth for appearance. Sometimes we want to straighten teeth for oral hygiene reasons. When you have crooked teeth, especially in the lower anterior area, your bottom teeth, it's very hard to floss those teeth. You were talking about flossing, Anita, and how, you're very diligent about flossing. When you cannot floss your teeth properly, you get plaque accumulation there. And plaque has bacteria in it. And that bacteria eats away at your bone. And when you start to lose bone, then you'll start to lose your teeth. So it's really important, and I preach this to my patients a lot. I spend a lot of time talking to my patients, a lot of time. And I tell my patients that it's not so much about your appearance, because they say that, I've had this all my life. But really, a young patient that comes to me, maybe 40 years old, 50 years old, when they have crooked teeth in the front of their mouth, especially in the bottom, and they can't floss and I see plaque accumulation, I'm going to get nervous, because I know by the time they're 60, 65, they're going to lose bone and they're going to lose those teeth. So if they don't do something that they're straighten those teeth out and they get better oral hygiene, then they're going to have to think in the future what they're going to do to replace it.
Sounds like this is all preventive dentistry, isn't it? We hear about prevention in medicine, and now we're doing it in dentistry. So let me tell everybody, if you would like to go and have a consultation with Dr. Rosemary, and everyone needs a dentist at least once a year. Hopefully, if you're having a problem, you may even go twice a year. Phone number is 954-489-1345. Just call, ask for Dr. Rosemary, ask them to make an appointment for you. And I'm sure her consultation is free. Just
complimentary.
Complimentary to come in.
Absolutely.
And have you look at everything. The phone number again is 954-489-1345. They're located. It's the Adult and Geriatric Medical Center, and it will really be very pleasing to you to, of course, to meet Dr. Rosemary. You can hear she's very enthusiastic, and she's extremely knowledgeable, very, very experienced. Okay, well, I'm glad you talked about that because I was thinking, well, no one wants to have their teeth straightened when they're 50 and 60, but if you can't see it, Invisalign sounds like a wonderful thing. All right, let's keep continuing. Is it possible, and that I've heard someone say that they had to have their wisdom teeth pulled, and they were actually in their 50s. Why do they have wisdom teeth? Tell me about wisdom teeth. I don't even. Why do they even go? Does it make us smarter? What is wisdom teeth?
No, sometimes people are born with wisdom teeth, and some people are not. We have 32 teeth in our mouth, including the wisdom teeth. Some people, they come in, and some people, they don't come in. They're the last molars, and some people develop them, some people don't develop them. Some people who develop them, sometimes they come in straight. Sometimes they don't come in straight, and sometimes they never cause a problem for some people. The bottom line is, if it is coming in at an angle, or it's causing problems, it's causing pain to the patient, or it's coming in at an angle that it's damaging the tooth in front of it, anything like that, you want to have it extracted. If it's coming in straight and it's not causing any problem, we leave it alone. There's no reason to extract it if it's not causing any problem. So wisdom teeth, or the last molars, there's an array of ways to treat it. I mean, you can talk to 10 people, and 10 people will give you 10 different answers what had happened with their wisdom teeth. At the age of 50, to have them removed, it's not as common. You don't hear so many people saying in their older years they have decided to do something with them. Usually by the age of 20 or 30, treatment will be decided. Why? Because by that time, wherever position they're in, they're going to be in, and they're going to stay in. Now, somebody at the age of 50, it could be that they were told from the age of 20 or 30, you need to do something, and they may have never done anything, and now at the age of 50, it has gotten so bad that they say, I have no choice, because sometimes these teeth come in at an angle, and they're actually pushing the tooth in front of it, and pushing that tooth in the sense that it's causing decay and eroding the tooth in front of it. And we tell patients, if you don't extract this tooth, it's actually going to decay further the tooth in front of it, because it's such an angle. It's completely horizontal. And patients say, it's not bothering me. And they leave it, and this is a 25-year-old patient. Now they leave it. Chances are by the time they're 45, 50, that will be the only reason that I can think of a 50-year-old will get their wisdom tooth out. By the time they're 50, that second molar, meaning the tooth is pushing into, is already decayed now so far that tooth is completely rotted. So now the patient has to have that tooth taken out and the wisdom tooth taken out. Do you understand?
Yes, I do.
That would be the reason why. But routinely, it's not common for an older person to have a wisdom tooth taken out. Not if they were not told when they were younger.
One thing that I know you know so much about is the diet and food and what's good for your teeth. And maybe every time when you're on the show, we ought to do like a little segment on good food, what it does to our teeth, and what kind of vitamins. I mean, why don't you take a little bit of this and give us some good information and some tips about eating and how that's going to help have good, healthy teeth? One
really important thing is that almost everything we eat has sugar in it. Almost everything we eat has sugar in it. And cavities are not just for young people. People, when I have some older patients, they say, how could I have a cavity? They're amazed that at 60 years old, 65, they can get a cavity. But really, everything you eat, milk, cheese, even some of the best stuff that really we should be eating, we should be having something of all the 5 food groups, fruit. All of this stuff has sugar in it.
No, it's not sugar that we're putting in it. You're saying it's part of the sugar, the content.
It's part of the content in it. It's part of the content.
I never think about that.
It really has sugar in it. So it really goes back to good oral hygiene. You have to really be conscious of how you're caring for your teeth. After you eat, it's important to rinse your teeth maybe soon. A lot of times I hear patients after they have dinner, before they go to sleep, they don't brush their teeth. When they wake up, or they brush their teeth once a day. either maybe in the morning they don't brush or at night they don't brush. So it's really important. One thing I can stress about this is that they really brush their teeth, because after you eat, all the bacteria and all the food, all the sugar, it's sitting on your teeth. And the sugar really, those acids are what are from the sugar demineralize your teeth. It takes 20 minutes for the acid to demineralize your teeth.
Amazing.
Yeah. So it's really important that we have good oral hygiene. Now, there's certain foods that are better that you eat with a meal, like lemons, tomatoes, things like that. Why do you say that? Because when you eat those foods as part of a meal, the saliva that you're generating as part of an entire meal will help wash away the acids from those foods. Whereas if you just eat a grapefruit or you just suck on a lemon like some people do, the acids in those foods will just start to demineralize and take the mineral away from your enamel.
Amazing. I mean, nobody ever has told us that. I think this is great. I hope you're going to be able to give us a lot of things like this.
Yeah, and one other tidbit I'll give you.
So if we're out and we're eating, we should go into the bathroom. The restaurant, that's a little embarrassing.
Well, I'm going to tell you one thing they sell, which is really good. My kids use it, and I really promote it. They sell them in the store. It's called Wisps, and they're almost like little toothbrushes. And really, they just they sell them in the drugstore, and they're like little mini toothbrushes. And I think they have like little toothpaste on or something. You get them, you just go in the bathroom, and you can just clean and just pick through your teeth or whatever. I mean, if it's possible, and this way you're really able to keep your teeth clean. If you're out somewhere, you're going to be out for many hours. If you go out for dinner and you're going to go home after that, to brush your teeth, go to sleep, it's fine. But if you're going to go out, you're going to a show afterwards, you're going to go to a party.
That's most of us.
And you're
going to go right home and do
right,
that.
And you're going to be out for many hours, then at least go home and go to the bathroom, just clean your mouth a little bit, something. So at least all of the food or the wine you drank, something is out of your teeth. It's always better. After I eat lunch, I always try to brush my teeth just to get that paste, the extra food, the excess food out between your teeth.
And so we don't have to really carry a toothbrush and paste with us. We can get these little wisps and
these little wisps
to do that with.
Yeah, it's in the drugstore. Another thing that's really good, chewing gum. Now, everybody doesn't really want to chew gum, but sugarless chewing gum actually will help dislodge the food from between your teeth.
No kidding.
So chewing gum is actually recommended. Orbit, that chewing gum, is actually recommended. It's sugarless. Okay, I actually give samples out in my office because it actually will help. It's actually good for your teeth because you're generating saliva when you're chewing gum. Okay, you're actually getting the food, the extra pieces of food that's in between your teeth. What does chewing gum do? It actually gets those pieces of food out from between your teeth.
Now, that's amazing because I was always told that chewing gum is not a very nice. I guess you shouldn't do it out in public. You should just do it
and don't chew like a cow.
Right.
Right.
It's true. Oh, talk about, someone wants a job and they come in chewing gum.
And they're chewing. You can chew discreetly.
No, right.
If you chew discreetly.
Right.
It's okay to do it.
Right.
I mean, just it depends where you are.
Of course.
And, if you're at the opera and you're chewing loud.
I don't think so.
That's not going to work. It depends where you're going. But that's just another little tidbit.
Now, when you come to Dr. Rosemary, I'm sure she'll tell you a lot of things like this. She's a lot of fun, but she's very smart, and she's very enthused about what she's doing. So let me give you her phone number. Dr. Rosemary's number is 954-489-1345. That's 954-489-1345. And make an appointment. You can have a free consultation or a complimentary consultation. And then I'm sure everyone has something in their mouth or their teeth that they're needing done. Why don't you go there, see what she thinks about it, and you're going to enjoy her as much as you're going to enjoy her professionalism. Okay, well, those are some good tips. What else would you suggest that people do? I mean, when you said about sugar, that amazes me because the people aren't eating sugar, but they're eating it in the natural part of the food. So you can't help that. But what you said is very interesting about the acid part. If you're eating a grapefruit or even wine, is wine also, is that acidic?
Well, I'm biased.
I know.
That's a bad question to ask me. It's okay. If it's red wine, just brush so they don't stain your teeth.
Brush. That's right, but it is true because that can stain, can't it?
100%.
So you have to make sure you're doing that. Yeah.
Just brush after.
But let's talk about coffee. Doesn't coffee also stain?
Absolutely.
Does tea?
Dark tea will, yes.
So when people have dark, but then they can have a cleaning, and then won't you get that off?
Yeah. Oh, absolutely. But what they have to do is they really have to just brush. I mean, I whiten my teeth, and I love my latte. I love espresso, and you know what? My teeth. A lot of my patients will say, "Oh, I want to get my teeth as white as yours."
White, I know.
That's what my teeth. My patients tell me that all the time.
How do you keep them so white, Dr. Rosemary?
I do. I brush twice a day. I'll brush during the day after I eat. I'm not crazy about it, but like I said, I do love my latte. I definitely drink my espresso during the day. So as long as you're brushing, as long as you're keeping your teeth clean professionally, I don't think it's, you're going to go, nothing's going to happen. Like I do a lot of whitening to my patients in the office, and they ask me, how long is this going to last? It'll last. I don't have any patients coming back to me after 6 months or 8 months and saying, you know what, doctor, look, my teeth are yellow again. I have never had that happen to me. Never. So it lasts. Even patients, everybody has a glass of wine. Everybody drinks some coffee or soda. I mean, I don't drink any soda, but all patients do these things, and I've never had anyone say anything.
I have to tell you, one time, and I try to eat properly, but one time I was eating a carrot and broke my tooth.
Ooh.
Broke my tooth eating a carrot. Isn't that amazing?
Yeah.
I guess you have to be careful what you chew on.
Yeah.
Did you eat the hard candy? Yeah, I did it. Did you eat hard candy?
Yeah, I don't eat hard candy. You have to be careful with that. One thing it's a good point about candy, because a lot of patients suck on lemon candies and things like that because they don't have saliva in their mouth. It's okay to do that to stimulate saliva, but just make sure it's sugarless. Or they suck on cough drops, a lot of patients. A lot of times I'll see patients who come in, or people that come in, and they're sucking on something, candy, cough drop, anything. Just make sure it's sugarless, because just think about it. If they're sucking on a candy or something and it's not sugarless, they're bathing their teeth in that sugar, all day long, and because usually they just suck on it just to stimulate the saliva, because they have dry mouth from a lot of the medications they take. Sometimes it's these hypertensive medications and different things, and it dries out their mouth. Sometimes it's a diuretic. It's different medications they take, and it gives them dry mouth. So you have to be very careful, because that will decay your teeth.
So if someone has dry saliva, is there something else they can do beside suck on candy?
They can suck on candy. There's things they sell in the drugstore. Biotine has a whole line of products for dry mouth. That's really what their specialty is. Biotine. They sell mouthwash. They sell paste. They sell a whole line of products.
You just said the magic word. I want to know about mouthwash. I have to tell you, I don't mouthwash. I don't use it. My husband uses mouthwash. I mean, I thought he was drinking. He says, I don't drink it, but he uses a lot of it. Why does he do that?
He probably, what does he use?
Listerine.
Oh, that's the best.
Really?
That's the best.
Oh, see.
I love it. Listerine is the best. Listerine is also one of the ones that is, most studied and, recommended from the American Dental Association. It has antibacterial properties. It has some of the newer ones have anti-cavity properties, so it really fights cavities. I think it's called 6-in-1. There's something to fight cavities. It has something to fight gingivitis. It has like 6 different properties in it, and it's great, and it comes in all these different flavors. Highly recommended. I use it too. My whole family uses it.
But how often should you do that?
Twice, every time you brush.
Oh, so it's coming after brushes.
Every time after you brush. Sometimes if you want to use it just without brushing, just to rinse with it, just to get rid of the excess food in your mouth, just to freshen up your mouth, you can.
Well, see, and I've been picking on him. I said, why are you doing that
now,
all the time?
One thing you should be aware, sometimes, and this doesn't pertain, I'm sure, to your husband, but sometimes, well, we're going to find out, everybody, right now. Sometimes these mouthwashes have alcohol in them.
Oh, yeah.
So, if the patient is an alcoholic.
You can't drink it.
Yeah,
right?
or if the patient is an alcoholic or, has any history of it, sometimes we recommend not to use a mouthwash with alcohol in it because, it has alcohol in it. They don't drink it, but just, I guess, anything with alcohol, and patients who are alcoholics, their doctors would rather them use mouthwash without alcohol in it. So just to be careful.
Well, that's a very good point you bring up, because maybe there are people who know they're addicted to alcohol. They don't drink anymore, but they may be having that, and that wouldn't be good then.
Right. It would not be good. If you have any sort of problem with alcohol, do not use a mouthwash with alcohol in it. And there's a lot of them out there that don't have alcohol in it. So you don't want to use it, because that little bit of alcohol, what it'll do is you will not want to drink the alcohol, but the alcohol in it will do something to stimulate, I believe, your desire, I guess, for alcohol. So people who are even recovering alcoholics, we never want to recommend mouthwash with alcohol in it.
Okay, now I'm going to move way over to the other end. I want to talk, because I know you have wonderful dogs, and unfortunately my doggie just died. But talk about the teeth of dogs. And I know you're not a vet, but I'm sure that you know enough about that. What should people be doing with a dog's teeth?
Cleaning their teeth.
But they don't like it.
Well, you know what? Then they should get. They sell the little finger cots. That you can, the little toothbrushes that you can get in and you can clean their teeth. The other thing they should do is they sell these little bones that they sell in the pet store that have teeth whitening capabilities that gets the tartar off their dog. Because my little Chihuahua is, he's a pain. He doesn't like us to clean his teeth, but he has terrible breath. So what we do is we give him bones, and those bones really help fight the tartar off of his teeth, and it freshens his breath.
Well, see, I know. I can ask Dr. Rosemary anything. She never knows what I'm going to ask her, but she's right there. She knows it.
Because she loves her pets.
Yeah, she loves her pets. So we'll talk more about oral health for dogs maybe in our next show. Let me give you her phone number. I know you're just going to love meeting her. You're going to really want to talk to her about becoming your dentist. It's 954-489-1345. That's 954-489-1345. And she's in the Adult and Geriatric Medical Center, and it's over there on East Commercial Boulevard in Fort Lauderdale, very close to Holy Cross Hospital. Dr. Rosemary, I look forward to our next show next Saturday at 4 o'clock.
Great, Anita. Thank you so much.
My pleasure.
It was wonderful being with you.
Bye.
Bye.